Thomas Graham is a double pioneer in the field of pediatric cardiology. In his nearly 40 years at Vanderbilt University Children's Hospital, he's launched the Department of Pediatric Cardiology and established it into one of the most respected in the nation. He is internationally recognized for his pioneering research of the right ventricle of the heart, which has led the way to helping surgeons save the lives of countless children and adults with congenital heart disease. Dr. Graham says he became fascinated with the heart after taking his first-year physiology class at Duke, taught by then Chief of Cardiology, Madison Spock.
Dr. Spock was showing a motion picture of a heart, a congenital heart problem. He was very enthusiastic. He was very into his work, and I was hooked right from that. It's a muscle that works for 70 or 80 years continuously, and how it does that and how it continues to work despite all the things we do to abuse it at times, and it just fascinated me.
After internship and residency at Boston Children's Hospital and 2 years doing research at the National Institutes of Health, Dr. Spock lured Dr. Graham back to Duke in 1967.
I had known him as a medical student, and he was one individual we desperately wanted to get to our program at Duke. All you had to do, we knew if we just get him here, we just leave him alone. When
I got back to Duke, I was able to start working on right ventricular volume studies and to do one of the first studies on normal values for right ventricular volume. And then I parlayed this into studying all the congenital defects and how it affects the right ventricle.
It was significant because you could get angiograms, you could get it doing contraction and relaxation, and you could see how much of the total amount of the blood was pumped out of the ventricle each time, and that was a critically important method to develop, and it really was the forerunner that's led to the common day practices worldwide now.
I also love to work with children, so pediatric cardiology became what I wanted to do after I saw Dr. Spock and heard him talk.
In 2004, Dr. Graham retired as chair of the Vanderbilt Medical Center Division of Pediatric Cardiology, and Vanderbilt established the Thomas P. Graham Lectureship in Pediatric Cardiology and the Thomas P. Graham Endowed Chair of Pediatric Cardiology. Vanderbilt honored him with a festive retirement party.
They had the president of the university, the chancellor of the medical school, they had every prestigious person there bestowing all these great honors on Tom.
It's been a great time here. I thought maybe we'd stay 10 years or so, but we've been here almost 40 now. Vanderbilt's been very good to me, thank goodness.
Dr. Graham says he learned a great many things while at Duke that helped mold him into the successful physician-scientist he became.
Duke is special because it believes in doing things right and really getting after a problem in terms of research and going all out to try to solve that problem with every means in their power. I love being at Duke because that's where I met my wife first in undergraduate school. We were married after our first year in medical school.
The Grahams have 3 children and 8 grandchildren. Their daughter Bethany is a Duke undergrad and medical school graduate who is an oncologist in St. Louis. Their son Brent is the director of pediatric rheumatology at Vanderbilt, and their daughter Brooke is a teacher in Seattle. Aside from family, Dr. Graham has a special passion for golf. In fact, during his retirement party at Vanderbilt, he was presented with a special gift.
And so they brought an envelope and gave it to him, and then they announced what it was, and they said that's a special trip to play golf in California. And Tom just lit up. He looked like he was ready to leave. All the honors didn't mean anything, but he sure was proud of getting to go play that golf.